Hi everyone, I would like to present one of my projects today, which is a systematic review and meta-analysis focused on exploring the potential effects of omega-3 supplementation on muscle damage recovery from exercise. What does muscle damage mean? It is a normal response to unaccustomed exercise and can affect everyone. Gentle exercise, massage, and NSAIDs are often recommended to alleviate symptoms, but they haven't proven effective in restoring function. This may lead to lost training time or dropout, especially for newcomers, and long-term NSAID use can impair training adaptations. So, evidence suggests that reducing inflammation and oxidative stress can alleviate muscle damage symptoms. Thus, nutritional strategies targeting these factors may enhance muscle recovery. Omega-3s are potent anti-inflammatory agents that may reduce muscle damage by protecting cell membranes and acting as analgesics to reduce muscle pain. This can improve muscle function and better recovery. And Australian Institute of Sports highlight the need for more research on omega-3 and their potential role in muscle damage recovery. And so we chose to systematically analyze the literature. Following our search strategy, we utilized Covidence to identify and screen the title and abstracts of all studies, and at the end, 43 human studies that assessed fish oil intervention for its efficacy in moderating exercise-induced muscle damage symptoms have been included. Most included studies were randomized controlled trial, and their internal validity was assessed by using Cochrane risk of bias tool. And at the end, 17 studies had a high risk of bias. There's a lot of information about these studies, but in brief, based on our literature analysis, there is no clear rationale for omega-3 dosing or duration. Compliance is often poorly monitored, and with 27 studies checking it, and just 18 of those using blood tests to assess omega-3 levels. There's a lack of research on females, and muscle damage protocols are not standardized. But when reviewing the pain results, 19 studies show that omega-3 supplementation reduced pain from muscle damage, 15 studies reported reduction in muscle damage markers, and 16 studies showed improvements in muscle function. While methodological limitations, including heterogeneity of study design, small sample sizes, and inconsistent compliance reporting, limit the certainty of our conclusions, the available evidence tentatively support long-chain omega-3 PUFA supplementation as a non-pharmacological strategy to assist recovery from exercise-induced muscle damage. And the most consistent signal was observed for reduced muscle soreness with more limited evidence for benefits to strength and functional recovery outcomes. However, the current evidence base is not yet sufficient to support definitive recommendations regarding optional dose, duration, or target omega-3 status. Thank you so much for your attention.